How long did it take you to recover from the benzos?
Well, when I finally... 2 years.
Benzodiazepines like Xanax, Ativan, and Valium can be very helpful in managing the acute symptoms of anxiety, but there's another side of the experience of using these medicines. Hello, and welcome to the Dr. Suzette Glasner podcast. Thank you to those of you who have been liking my videos and who have subscribed to my YouTube channel. If you haven't done so already, please do take a moment. Please know that I read all of your comments and questions, and if you have additional ones for me that you don't feel comfortable sharing directly on YouTube, you can email me at askdrglassner@gmail.com, and I would love to hear from you. Benzodiazepines like Xanax, Ativan, and Valium can be very helpful in managing the acute symptoms of anxiety and panic. And in part because of their popularity societally, they have made their way into various TV storylines. Most recently, one of my favorite series, Landman.
Mom?
I'm here, baby.
We know that, honey. The whole hospital knows. I know you got a Xanax on you, so go out in the hallway and take it. And wait till it kicks in before you come back, okay? How about that?
I'm gonna be right outside, baby, okay? Okay.
Okay.
Oh my God!
But there's another side of the experience of using these medicines. Unlike the panacea they offer in the face of acute distress, like the character of Angela Norris from Landman experienced, discontinuing them can lead to what some people have described as brutal withdrawal symptoms, both physically and psychologically. One person who's been particularly outspoken about this is prominent psychologist, author, and professor, Dr. Jordan Peterson. He has described the multi-year process of withdrawing from and getting off of benzodiazepines as a period of hopelessness and the lowest point of his life. He had such a severe physical dependence on benzodiazepines that he was placed in a medically induced coma for more than a week to bypass the experience of the tormenting withdrawal symptoms and successfully taper off of them. Now, this was an experimental treatment and one that he underwent after multiple failed treatments in other settings and failed attempts to detoxify and get successfully weaned off of benzodiazepines. So this is not the mainstream, certainly a more extreme case. We do know that benzodiazepines, like Xanax and Valium, are one of the most prescribed medicines in the country, with over 92 million prescriptions dispensed annually in recent years, 30 million of which are Xanax alone, and that is followed by Klonopin and Ativan, which are also in the tens of millions, and then Valium, which is a little bit less than 10 million. So what is it that most people don't know about benzodiazepines that might lead to a different choice of solutions to anxiety and sleep issues? I want to talk about three things. First, benzodiazepines are meant for short-term treatment. So we're talking 2 to 4 weeks or so. And they're approved for the treatment of anxiety, panic attacks, acute stress, and sleep difficulties, as well as a few other problems like alcohol withdrawal and even seizures. The longer you take them, however, the more likely you are to develop a physical dependence and potentially addiction. Now, it is a bit more common that we see physical dependence than the full syndrome of addiction like you see to other drugs, but we do know that ultimately anyone who takes this type of medication over a long period of time on a regular basis has the strong potential to develop a physical dependency on them, and that leads to difficulties with discontinuing the medication. Number two, when they're used regularly, stopping use of them abruptly or even drastically reducing one's dose of a benzodiazepine without a gradual medically supervised taper carries a risk of serious and potentially life-threatening withdrawal symptoms. And third, and finally, getting off of them safely and stably can take anywhere from months to years.
How long did it take you to recover from the benzos?
Well, when I finally, 2 years.
So Jordan Peterson went through what's known as protracted withdrawal. And what that means is that the withdrawal symptoms from benzodiazepines in certain people and under certain conditions can last well beyond the expected period of time that it takes the body to eliminate benzodiazepines from their system. So typically, you would see these withdrawal symptoms emerge and resolve over 4 to 6 weeks or so. But some people experience these symptoms for months or even years, as Dr. Peterson described in his experience. Let's talk about what protracted withdrawal symptoms might look like. They fall into a couple of different categories. The first is psychological. That can mean anxiety. It's sort of like a rebound, or the opposite of the symptoms that it was supposed to be helping somebody to manage and control, right? So it's increased anxiety, it's depression, it's what we call anhedonia, which is the inability to enjoy things or derive pleasure from things that one used to do for enjoyment, and even hallucinations. Now that's the psychological effects. There's neurological symptoms as well, and this can include poor memory and cognition. It can include feeling very distracted and unable to concentrate. It can even include some other neurological symptoms like ringing in one's ears. And then we have what we call neuropsychiatric. And these are some of the more kind of distressing symptoms that people experience. Dr. Peterson described experiencing what's known as akathisia. Akathisia is this intense urge to move one's body along with a severe feeling of restlessness, sort of like you're crawling out of your skin. And this has been described by many people as an unbearable, very uncomfortable symptom. And in some people can lead to feelings of wanting it all to be over and wanting to end their life, or suicidality. Psychosis is another symptom, and that's like a break with reality, right? And can take the form of hallucinations or delusions. And Jordan Peterson was actually at one time during this multi-year process of withdrawing from benzodiazepines, he was diagnosed with schizophrenia because of the presence of psychotic symptoms. They discovered later that that was not a correct diagnosis. He did not have schizophrenia, but it was really withdrawal complications, and thankfully it resolved. Some of the other types of symptoms that people can experience are what we call motor disturbances, sort of difficulty with movement, stomach upset or gastrointestinal disturbances, insomnia, and dizziness. So why does this happen? It's really thought to result from both the psychological and physical effects of one's body becoming dependent on benzodiazepines, as well as the neurological effects of benzodiazepines. So a lot of this is thought of by some researchers as a neurological type syndrome that emerges in people who are trying to withdraw or discontinue their use of benzodiazepines.
And this is something that Dr. Carl Hart, who's I love him to death. He's brilliant. He speaks so openly and honestly about drugs, and the guy's a professor at Columbia. He said that there's 2 drugs that will kill you when you get off of them. He goes, it's alcohol and benzodiazepine. Those are the 2 that if you just quit, you'll fucking die.
Or you wish you would.
Meanwhile, they're handing those things out like Tic Tacs.
So now, just to clarify something that Joe Rogan said, death from benzodiazepine withdrawal is actually rare. Death is more commonly associated with use of benzodiazepines than withdrawal from benzodiazepines. The way that use of benzodiazepines can lead to overdose and death is typically when it's combined with other downers like alcohol. That's why people say never drink alcohol when you're taking benzodiazepines, and also certain substances that also can depress the central nervous system like opioids. Peterson's reflection about the potential to become suicidal are backed up by research, however. So there was this one study of over 1,000 individuals who were facing challenges with discontinuing their use of benzodiazepines, and over half of them reported suicidal thoughts or attempted suicide after discontinuing their use of benzodiazepines. So what can you do about this? Well, the current guidance suggests that reduce the dosage under the supervision of a medical qualified professional, preferably an addiction expert, in a very gradual way. And that can reduce the risk of protracted withdrawal symptoms. So who's at risk for this? Who does this happen to? It's not like everybody who takes benzodiazepines will go into this protracted withdrawal syndrome. So it's longer-term use of benzodiazepines, which unfortunately, even though we know that clinically benzodiazepine use is recommended for 2 to 4 weeks or so as a short-term solution to sleep disruptions, acute anxiety, panic attacks, etc., the ongoing prescriptions for more than a period of 120 days or 6 months or longer is really quite common. Some people are prescribed these for years or even for decades. So longer-term use and use of high dose, what we call rapid acting benzodiazepines, increase the risk for protracted withdrawal. However, post-acute withdrawal symptoms can also occur after discontinuing low-dose benzodiazepines. And if you listen to interviews that Jordan Peterson engaged in, he does say that it was a low-dose benzodiazepine that he became dependent on. So it could happen in either scenario, but it's more likely with what we call rapid-acting benzodiazepines, and those include the ones whose effects can be felt very shortly after taking them and are shorter lasting. So one example of that is Xanax.
Well, when did they know? When was it in the literature, the difficulty of detoxing yourself from these?
Very recently.
Really?
Yeah.
Jesus Christ. And when did they start being handed out?
20 years ago.
Fuck.
So Jordan Peterson is right about this. It has been a little over 5 years since the FDA announced changes in the approved prescribing information for benzodiazepines, including an updated boxed warning that describes serious risks of use and that potential to lead to physical dependence, especially with longer treatment duration and or higher daily doses. So this is fairly recent, in the past 5-ish years, that there has been a lot more attention from the clinical and scientific community on the safety issues with discontinuing benzodiazepines. So as far as how you get off of them, well, as I mentioned before, the newest guidelines suggest sort of a slow and gradual tapering, and just knowing that it could take months to years to fully taper off of benzodiazepine, just to set your sort of expectations, especially if somebody's been taking a high dose for an extended period of time. Now, some people will decide in collaboration with their doctor that the risks of discontinuing completely outweigh the benefits. So sometimes as a person is going down, they start to experience really uncomfortable and unbearable withdrawal symptoms that it's really hard to get a handle on. Sometimes medications can help them handle that effectively, but some people will choose to taper down to as low of a dose as they possibly can and then stay on a low dose over the longer term. And that's really a decision that you want to make in close collaboration with a doctor that you trust. We also know that psychotherapy can be super helpful in managing the withdrawal symptoms without losing hope, because as Dr. Peterson describes, there is this feeling of hopelessness when the symptoms are that severe and that difficult to tolerate about how things are ever going to return to normal. So psychotherapy can be really, really impactful at a time like that in helping a person learn to cope with the discomfort over the course of that tapering process. So I want to conclude by saying that even though this might sound like sort of a grim scenario for benzodiazepine dependence and what it would take in order to get off of them, I do know a lot of people who have done this successfully. It's just that a lot of people are surprised by what it takes to get off of them successfully and just how physiologically dependent they've become. So in part, my messaging to you today is around being knowledgeable about the risks of long-term use of benzodiazepines and really asking the right questions as an informed patient and consumer of medical care.
I have one good friend that takes it every day and takes it oftentimes with alcohol, which I know you're absolutely not supposed to do. There's not a damn thing I can do about it. This is a friend that I love to death, and I put my hands up and I go, there's nothing I can do.
And finally, don't give up hope. Joe sounds like he's given up on his friend, who he later notes has been doing the same thing for a decade. And while it's easy to give up on somebody who's in a persistent pattern like that, and it can be maddening to be close to somebody who is doing something self-destructive, you really never know when somebody's going to have a moment of insight, recognizing that their life just isn't where they want it to be. And don't be afraid to be that voice of reason. As an example of that, here's what got Jordan Peterson to the other side of benzodiazepine withdrawal.
I've learned some things during that trying time, I suppose, or at least I can tell you what kept me going during what was certainly the worst period of my life. Family, that's for sure. Friends, and the work I was able to continue doing as I was able to continue writing.
So my message to you today is keep fighting for the people you care about and never give up. I look forward to seeing you next time.